Well, there's new hope in the fight against dementia. A report released in the British journal, The Lancet, says 1/3 of cases could be prevented through lifestyle changes. CBC's medical contributor, Dr. Peter Lynn, joins us now to talk about those findings. So let's first start with this particular study that we're seeing here, that 1/3 could be preventable. We hear about studies like this all the time. What makes this significant?
Yeah, so this was 24 world experts in dementia, and they got together and looked at all the studies that they can get their hands on, and that's where they came up with all these numbers. So they said, what are the things that are related to dementia? What are the things that we can fix? And then they came up with numbers specifically. This 1/3 sounds very good, and that we can prevent. And then they went through the list, okay? So there were some things that we knew already, you know, like high blood pressure is bad for you, diabetes is bad for you, cholesterol, smoking is bad, physical inactivity. Those are all things that are bad for your heart too. So whatever's bad for your heart is also bad for your brain. So I think that part we knew. Then they started talking about education. So if you made it to, 15 years of age, okay, of education, that was better off. So in other words, if you allowed your brain to have more, connections, then when you start losing those connections, you have more to lose, and so therefore you can actually maintain some of your memory as well. And they also talked about hearing. This was new to me. So hearing loss was huge. They were saying it accounts for about 9% of the dementias, and that's because once you lose your hearing, then you don't want to go out and talk to people. So it's not just losing your hearing, you're losing the social interaction. So then I don't talk to you, I stay at home. Now the rest of my brain is not stimulated, and therefore we start to fade away. So therefore social isolation was a big problem, and also depression. It turns out depression hits the same area of the brain that the dementia does. So therefore, if we don't treat the depression well, that part of the brain suffers, and then later on we see that they have more dementia as well.
So some interesting discoveries, revelations that are coming out of this research, but there's nothing in there that necessarily says that these recommendations will entirely prevent dementia. So how can we sort of decipher between what is potentially preventable and what is actually preventable?
Yeah, that's a good point, right? So what these are associations, right? So in other words, the perfect study would be this, right? We take 100,000 people, and then half of them we fix their hearing, for example. Everybody gets a hearing aid on this side, and on the other side we let them stay, deaf, for example, and then we follow them for 30 years. So that would be a perfect scenario where we could see whether fixing your hearing is good or not. Now, we're not going to do a study like that. I can't follow people for 50 years, and I can't say, okay, you don't get a hearing aid, for example. So that's why, because we can't do those types of studies where we can definitively tell you the answer, we go back to these kind of studies where we look at patients with dementia and we say, what's different about them than the people that didn't have dementia? And they started noticing they had less education, they had more hearing loss, they had all of these things. So this big long list sort of came from what is different about them, and then that's where they came up with some of these numbers and these recommendations.
So there's some recommendations, but there's also been some sort of long-standing recommendations too. So as these reports continue to come out, what stands out as sort of the single most effective thing when it comes to preventing dementia?
Yeah, I think the communication, like talking to people. The more I look at our seniors, for example, they become more and more isolated. So therefore the idea is that, let's say we're talking, right? So I'm listening to you, I have to figure out what you just said, and then I have to think of something smart to say back, and then I have to say it back, and then I have to look at your face, like, are you happy with what I said or not happy? So I'm giving my whole brain a workout just by talking to you. But then if we look at our seniors, what's happening is that they become more and more isolated as they get older, and they actually have less conversation. So therefore, those parts of the brains are not working. So we used to say play Sudoku or crossword puzzles. That's very one-dimensional, whereas this one, by having conversation, it would actually stimulate your whole brain. So I think that would be important to do.
And very finally, I do want to ask, it's especially important when we've got an aging population here in Canada. So are there any simple tests that people can do if they think a loved one might be suffering from dementia or early onset?
Sure. There's a quick test where you just do 3-word recall. So I tell you ball, cat, tree, and then you tell me it back. And then what I do is a few minutes later, I ask you, do you remember those 3 things? And if you remember all 3, you're okay. If you don't get any of them, then it's very obvious. The other one is clock draw. So what we do is we tell the patients, draw a clock that shows me 10 after 11. So 10 after 11 is kind of abstract. You have to figure out what that means. And it's very quickly you'll realize that they don't draw the clock properly. And then now you have a clock that you can take to the doctor. So if it's really abnormal looking, the doctor won't say, oh, they're 80 years old, that's why their memory is bad. It's more like, wow, this clock is really abnormal. And so it's a very easy way to identify those patients. But that's very important to identify patients, but more importantly, as this study is telling us, there are things that we can do. And I think one of them is that talking, the other one is sleeping. So they didn't track sleeping in these studies, but you and I know that when we don't sleep well, our brain does not function well at all. So if we can talk to each other during the day and get some early sleep and good sleep, I think that would be good things that we can do.
Some good tips. Thank you so much, Dr. Peter Lin, our medical contributor.